Okay, so GLP-1 medication side effects and how they affect your progress, exercise, all that fun stuff. Again, we've touched on this like really briefly before. We're going to try to dig into it a little bit more. For transparency, like any medication, there's a fairly long list of side effects that you can have. Some are common, some are a bit more abnormal. You should ask your doctor what that full list is to get an understanding of it. I'm going to be talking about the ones that are most relevant to exercise and are within my scope of practice to talk to people about. Those are nausea, fatigue, and digestive issues. The reality is, from like the holistic exercise management standpoint, is the approach for all three is very much the same. Um, Most of it comes down to just simply timing and modification and listening to your body. So what I mean by that is, timing is the easiest, so I'll start there. After an injection or the pill, if you're on the Wegovy pills, especially early on or right after you've increased the dose, as soon as you take them, that's often when your side effects are going to be the worst, because like the previous dose has tapered off a little bit and now you're at its peak again. So that's when people get like usually the strongest side effects of like nausea, fatigue, digestive upset, that kind of stuff. The easiest approach with your managing that with your exercise routine is just to not plan to take that right before when you would normally exercise or work out. If you're on the daily Wegovy pills, I think it's only Wegovy that has the pills right now, but if you're on the daily pills, obviously that's a little bit more difficult, but you can still manage it. Like I have a client that is on the pills right now, and we just really communicate about how she's feeling and kind of adjust as needed, especially when her dose has increased. The side effects are a little different. For some people, they're a little less. For her, they came much later after she got to a certain dose. Um, so we just kind of timed things, and it became my job to adjust her workout based on the severity of her symptoms. So if she's having really any symptoms at all, if the plan was to have an intense workout that day, that's not what we're doing anymore. The focus at that point just becomes keep your body moving, do some kind of resistance training that you can handle. Try not to get your heart rate like too high. We're not aiming for like a max output day, like a moderate, like zone 2-ish maybe heart rate is kind of like where we're shooting for. So something a little bit more moderate, just to almost more in recovery zone. So that's the movement approach or the timing approach for really all of those issues. The rest comes down to, and kind of the catch-22 here is, you should exercise because it does help with symptoms. It helps reduce some of those symptoms because some of them come from your body kind of responding to that and not knowing what to do with like muscle tissue and things like that. So you should exercise. So it's not, you shouldn't cut it out. You just have to time it. So keeping exercise as part of your routine as much as possible, and having, like, a lot of my clients will have like go for a walk as their fail safe movement. So if everything else is off the table for one reason or another, at least go for a walk. It'll get your blood flowing and it'll help a little bit and keep your body in the habit of like, we need to keep moving. And then when it comes to nutrition, it you don't want to go too long without eating, which can be really hard on medication that stifles your appetite. So just managing your food intake, it's kind of like small frequent meals is usually the easiest for that. So you're still getting in enough that, again, we're managing blood sugar and energy levels, and it's a little bit easier to digest. So small frequent meals can help throughout, especially again with the shots, especially a few days after the shot, or if you're on the daily dose, kind of like every day, small frequent meals, and as needed depending on the symptoms that you're having. Um, Meals that are relatively easy to digest. So relatively like simple, bland foods can make it a little bit easier. And of course, as we've talked about before, protein. High protein is very important for general health, for digestive issues, for a lot of the side effects, making sure that you're getting in moderate to high protein. Any protein source is fine, just moderate to high. And then the remaining thing to adjust for yourself is just like for you to modify as needed with your own workout, just kind of like how I do with my client, just adjusting things, reducing the intensity, having kind of like a plan A, B, and C, depending on the severity of your symptoms. And typically with medications, especially that have anything to do with blood sugar, I usually don't say this is like a power through, push through the pain kind of time. Like if you're feeling dizzy or nauseous, it's likely going to get worse if you push too hard in a workout. So like slow flow yoga, if that's what that needs to be, like some body weight stuff, like gentle movement, and just have a way to scale it back by like 15%, 20%, 30%, depending on your severity of symptoms. Again, there are a lot of other symptoms that someone can experience, but those are the ones that are kind of more in the like diet and exercise realm. And in my scope, talk to your doctor about all of the other ones and how you would handle those.